We got a problem here, folks. We live in a country that in the year 2016 has gotten so technologically advanced that a mere 50 years ago, what we take for granted today would be science fiction. Smartphones, virtual reality, missions to Saturn, beyond the solar system. Unfortunately, all of these technical advances, as miraculous as they appear to be, have done very little to help us with how we manage what is the most important aspect of our livingness, and that is our day-to-day health. The realm of wellness, that is the realm of sickness, that is the domain of modern medicine, as well as its customers, its patients, us, has a good news, bad news situation. The good news is we're living longer than we did a mere 100 years ago when life expectancy was in the 50s and 60s. You were lucky to make it to age 65 if you were alive in the year 1900. The bad news is that despite our increased longevity, our chronic disease rates, our prescription drug use rates, our obesity rates, our hypertension rates, our diabetes rates, our metabolic syndrome, our Parkinson's disease, our Alzheimer's dementia, in fact, most health markers that you can name, by any measurement, we are sicker than ever before. That's because while emergency treatment and surgical procedures and victories over infectious disease have made your doctor and the medical model into heroes, when it comes to what we call chronic degenerative disease, the kind of illnesses where the causes are hidden, not obvious, and lifestyle choices are involved, there is absolutely nothing in the doctor's bag of tricks that can create health. Only God and the divine force, through the built-in actions of the human body, can do that. That's because health is not about treating disease. Health is about helping the body maintain its own health, helping the body stay healthy, making the body strong by putting the good stuff in and leaving the bad stuff out. This notion of getting healthy by treatment, by lowering your test scores, by lowering your cholesterol or raising your good cholesterol or raising your TSH or your BMD is a flawed and really ignorant clinical notion that never makes us healthier. It's a manipulative, at worst, it's a manipulative and exploitative trick. At best, it is just flat out ignorant. It creates this priestly class of authorities and a subservient class, that's us, that functions as a ward of this authority class. It's not an act of kindness. Health today is not an act of kindness by a kindly MD. It's an act of commerce. It's an act of profit margin. And a lot of people make a lot of money by drugging and doctoring and surgically manipulating the human body and not making us any better, at least in the case of chronic degenerative disease. I got a letter yesterday from a gal who wanted to know about her chemo drugs and their possible long-term toxicity. And I'm going to tell you what I told her, what I wrote back to her. It's what I write back to anybody who asks about prescription drugs and whether they should take them or not and what the side effects are. Here's the deal. Drugs are literally cytotoxic. That means they are killers, literally, not poetically, not rhetorically. Specifically, they kill cells. You take your drug, you put it in a petri dish, you put a human cell next to it, that cell will die depending on how much medication is there. This is not disputable. Even a medical professional or a drug company lobbyist would not dispute the fact that drugs are cell killers. The only argument that they can make is that, well, we know that there are risks, but the benefits outweigh the risk. Or perhaps they'll tell you, oh, yes, we know that they're toxic, but the dose is small enough that you probably won't cause too much damage. So in other words, what I'm saying here is it doesn't matter what specific side effects you may get or the likelihood that you may get them. What matters is that when you take a drug, you're swallowing a poison that your body doesn't want, that it has to detoxify, and that can only contribute to your demise. It cannot make you better. It will cost you nutrition. It will accelerate the breakdown of your body, and that's just the nature of drugs. And you may not notice the side effects. You may take your drug for months or years, and you may not notice a side effect. Maybe you do notice a side effect, but you cannot avoid them. The particular side effects that are associated with particular drugs, those are based on statistical analysis. Oh, you got a 43% chance of having GI problems. Oh, you got a 22% chance of getting dizziness. Oh, you got a 15% chance of having a cardiovascular event. Those are statistics, and anything can happen, and it's all Russian roulette. But the fact is that when you take a drug, your body's got to clear it out like a poison. The fact is that a prescription drug operates as a that is cell toxin, as a poison. And this is where nutrition comes in. The body doesn't use drugs to get better, but the body does use 90 substances. We call them the essential nutrients. Doc calls them the mighty 90 essential nutrients. And they are mighty. And there are 90 of them. And they are essential because your body needs them like your car needs gasoline or oil. Your car needs gasoline or oil to run. Your body needs the 90 essential nutrients to run. They are what a cell eats. The 90 essential nutrients are they comprise the menu that a cell eats from. Just like any machine, you need to have something that gives the machine energy so for it to run. The body is just like any machine except with much greater sophistication. If you want a chronic health challenge, the easiest way to do it is to take an essential nutrient out of your diet, which means that when you put these things back in your diet, the chances are pretty darn good you're going to feel better. The chances are pretty darn good no matter what flavor chronic degenerative disease you have, the symptoms are going to improve. Now, of course, you got to do other things too. You got to make sure you're absorbing your nutrients, and that's where digestive health strategies come in. You got to make sure you're exercising a little bit. You got to make sure you're respirating. But the fact remains, there's not a single drug on planet Earth that can take the place of the mighty 90 essential nutrients. I'm Pharmacist Ben, sitting in for Dr. Wallach today. Thanks for listening. We'll take a quick commercial break and come back with more good health information right after this. Don't go away. There is no such thing as a prescription drug that does not come replete with side effects and toxicity. Whether we notice it or not, it's just in the nature of prescription drugs. And on top of all of that, your prescription drug isn't doing anything to get you better anyway, even if it does lower your test scores or raise your test scores. I'll be sitting in for the next 45 minutes or so for Dr. Wallach with my good friend and buddy Douglas Winfrey. What is up, Doug? How you doing, man?
Great to have you back on the show. And I wanted to talk a little bit about acid reflux today, as I came across a Fox News story from their medical advisor, Dr. Manny Alvarez, and says natural ways to treat acid reflux. And I thought, maybe we're going to talk about, apple cider vinegar or enzymes.
No such luck.
They say acid reflux is when the stomach regurgitates through a patient's esophagus, causing a sensation in the chest. It's commonly referred to as heartburn. Symptoms can vary and be treated with medicine, but sufferers should be aware of possible triggers. They say adjust your wardrobe to include more loose-fitting clothes. Extra pressure on the stomach makes it easier for acid to flow back into the esophagus. That'd have to be some tight pants, I'd have to think. They try adjusting.
I've never heard that before.
Yeah,
they're blaming it on your underwear.
Yeah.
Or your pants.
Or your shirt or dress or whatever. They say try adjusting your meal sizes to be smaller. Overeating can make patients more susceptible to reflux. They say sufferers that are smokers and nicotine weakens the muscles between the stomach and the esophagus that keeps the acid in the stomach. They say plus tobacco can cause the stomach to make too much acid. I never knew there was such a thing as too much acid. Patients also should sit upright after a meal for at least 3 hours so food can properly make its way through the digestive system. And last but not least, they say they should identify triggers. Knowing which foods cause reflux is crucial in alleviating symptoms. Some common culprits include fatty foods, spicy foods, caffeine, chocolate, citrus drinks, and alcohol. And they say if your symptoms don't improve over time, you should consult your physician. Not one
and get a drug.
And get a drug.
Right.
Yeah, get a proton pump inhibitor is exactly what you're going to get.
To suppress stomach acid.
Yeah.
So that you can't absorb your B vitamins and your minerals. So that you can't digest your food appropriately. So you can't break down your proteins. This is craziness, folks. I'm telling you. We're in a hypnotic trance. There's no possible way you're going to be able to suppress your stomach acid unless you poison your stomach acid cells without changing the way you changing the way you eat. It's as simple as that. When you were doing gluten back in the day, Doug, didn't you have a heartburn thing?
Oh yeah, I had a really bad problem for probably up until maybe it was not long after I met Dr. Wallach and I was listening to him talk about enzymes and things like that and realizing that as I'd had, acid reflux problems where I had to sleep propped up on, half a dozen pillows every night. And if I, fell over in my sleep, then I would wake up with acid reflux. And what made it go away, I started salting my food to taste and started taking some vitamins and minerals. And guess what? It all went away.
Isn't that interesting? I told you the story of Ted Anderson, right, at GCN?
Yeah.
He had this horrible heartburn. And just gave him a couple of little tips. Lay off the gluten, change the way you eat, make sure you're using your Mighty 90 essential nutrients, particularly the minerals, like you point out. And bingo, no more heartburn. And if you don't have heartburn, if you're out there listening, you don't have heartburn, let me tell you, it's not life-threatening or anything, but it's awfully miserable, I'll tell you. And if they give you a drug, like I was saying at the beginning of the program, if you're on a proton pump inhibitor, so-called PPI drugs, Nexium or Prilosec or the little purple pill or whatever it is, you may not notice that you've got any side effects or toxicity, but rest assured they're there. Earlier this year, or actually it was late last year, an article appeared in the mainstream press, risk of dementia in all elderly patients with the use of proton pump inhibitors. That means increased risk of Alzheimer's disease and other dementias if you start taking these drugs. Well, it's not so much that you take a proton pump inhibitor and you get dementia. The problem is you take a proton pump inhibitor and you suppress your body's ability to absorb nutrition. This is why dementia symptoms appear. This is why lots of symptoms appear, including osteoporosis and general breakdown of connective tissue. Don't blame the drug specifically, blame what it's doing. And that is, in this case, depriving your body of its ability to absorb and utilize the mighty 90 essential nutrients. You can't get away from it, folks. You're on a prescription drug, whether you notice or not. Something is going to go wrong in your body. That's just the nature of the beast. All right, I'm Pharmacist Ben. You're listening to the Dead Doctors Don't Lie radio program. 831-685-1080 is our priority line number. 888-379-2552 toll free. We'll take a quick break and come back with more good health information right after this. Talking a little bit about the drug mentality, the idea that you can drug yourself back to health. I'm telling you, it's not possible. There's no such thing as a drug without a side effect, whether you notice it or not. More often, many times, you will notice it. We were talking, Doug, before we went to break about the PPIs, Nexium, Prilosec, the purple pill, I think it is. It seems like it's a benign pill. You can get it over the counter. It doesn't seem like it's a big deal, but it is a big deal because what you're doing when you take that kind of drug, a proton pump inhibitor, is you're suppressing or shutting down one of the body's natural mechanisms, in this case, a mechanism for absorbing nutrients. So, of course, you're going to have toxicity and side effects. We talked before we went to the break about Alzheimer's disease. Just a couple of days ago, an article showed up in the on the website Drug Watch. PPI, heartburn drugs linked to brain problems and fluid buildup in the abdomen. Another study, this one from 4 days ago, or another article, this one from 4 days ago on the website Oncology Nurse Advisor. Myopathy, another side effect of PPIs. Limited research published in the Annals of Pharmacotherapy suggests that the use of PPIs is associated with myopathy. That means muscle pain and muscle problems. Myo for muscle, pathy for disease. Myopathy-like symptoms. Again, it doesn't matter the specifics. You can just assume that if you take a drug, you're shutting down something that the body wants to do. Another article, Nexium chronic kidney disease lawsuit filed over heartburn drug risks. That's AstraZeneca facing a product liability lawsuit that alleges side effects of Nexium cause chronic kidney disease. Again, I don't want anybody to think or to make the simplistic idea, oh, Nexium is a bad drug because it has side effects. Perhaps Nexium is a bad drug, but the point I'm making is all drugs have side effects and all drugs have toxicity. There's just no way to get around it. Another article, this one from the University of Eastern Finland. Antipsychotic medications linked to increased risk of pneumonia in persons with Alzheimer's disease. Antipsychotic medications shut down the body's immune system. So of course you're going to run into problems. And this is so tragic because it's so unnecessary. You guys know this if you're listening to the program. There is no such thing as a drug deficiency disease, but there are an endless amount of nutritional deficiency diseases. In fact, a good case can be made that every chronic long-term deficiency disease has at least one component or a small component of nutritional deficiency. What does this mean? If you're dealing with a chronic long-term disease, a disease that by definition is not getting better, if your doctor has told you, oh, you're going to be on this prescription drug the rest of your life, if you've been told you got to keep going to the doctor to get regular liver test scores or thyroid test scores or bone mineral density test scores, I'm guaranteeing you there is a nutritional strategy that you can use to feel better without integrating or interfacing with the medical model. Let us show you how simple and how easy that can be. Our number today is 831-685-1080, 831-685-1080, or 888-379-2552. If you've got questions about health, nutrition, prescription drugs, or the longevity products, we are here for you on the Dead Doctors Don't Lie radio program. Do you think we have time to hit the phones, Douglas?
Oh, we're going into
there's
a
the
break.
music. Okay, if you're on hold, hang on. We'll get to you when we come back from our break. I'm Pharmacist Ben with Doug Winfrey sitting in for Dr. Wallach today. 831-685-1080 is our priority line number, 888-379-2552, toll free. We'll take a quick break and come back right after this. Don't go away. Who is first in queue? Douglas Winfrey.
All right, let's head to Kansas City, Missouri. And Doug, you're on with Pharmacist Ben Fuchs.
Hey, Doug.
Hi, Pharmacist Ben.
What's going
I have
on,
a
buddy?
new distributor.
Oh,
On
congratulations.
the products.
Tell us your story.
And
I want to hear your story, Doug.
Okay. Been on the products for 90 days. He's had several health issues, and they've all cleared up except for
nice.
one. His blood sugar he can't get down at all.
Okay, that's good. I hear that a lot, actually. Here's the deal with blood sugar, okay? There's only two reasons why blood sugar gets elevated. Number one, because of the stress hormone cortisol, which is linked to emotional and mental stresses, as well as physiologic stress, whether it's a digestive health issue or an immune issue, autoimmune disease. If you have elevated cortisol, one of the ways the body deals with stress is by releasing sugar into the blood. So stress can do it, emotional, mental, as well as physical stresses. And the second reason, the main reason why blood sugar goes up is because we eat the wrong foods. And pretty much that's it. Now, nutritional deficiencies will contribute, especially nutrients that are electrical. It turns out that the most important nutrients for the blood sugar system are the electrical water-soluble nutrients. And by that I mean they're nutrients that we excrete out on a regular basis. So your three strategies for dealing with blood sugar are, number one, to figure out what is causing the stress response, whether it's an emotional or mental or physical issue, and start to deal with that. Number two, change the way you eat. You can eat more fat, you can eat more protein, although protein will get converted into sugar if you do too much and you're not using it. But most importantly, limiting your intake of sugar, blood sugar spiking foods. That is bread and pasta and potatoes and rice and desserts and fruit juices and pretty much all the foods we love. And I'm not saying necessarily zero tolerance, although the less you eat, the better off you are, but simply reducing your intake of these blood sugar spiking foods. A quick, easy way to do it is to increase the amount of fiber that you're eating, increase the amount of water that you're drinking, and also using more protein and more fat and less refined flours and other blood sugar spiking foods. And then the third piece of the puzzle is make sure you're using electrical nutrients, especially the B complex, thiamine, niacin, magnesium, calcium, potassium, sodium. These are water-soluble nutrients that are extremely important for helping the body process sugar. Also, arginine and taurine, which are two wonderful amino acids, and then making sure you're getting your ultimate EFAs. Where are you going to get all these things from? The Healthy Start Pack. The Healthy Start Pack is loaded with all of these electrical nutrients, particularly the Beyond Tangy Tangerine. The Sweeties has got chromium and vanadium, so important for helping the body process sugar. And then one of my all-time favorite supplements is niacin, and Doc has formulated a really neat form of niacin called the Ultimate Niacin. Niacin is part of something called the glucose tolerance factor, which is a biomolecule that helps the body process sugar. Niacin is a tried and true nutritional supplement for helping the body process fats, and niacin is also important for cardiovascular health issues that are often associated with elevated blood sugar. Long story short, it's simple and tragically simple to reduce blood sugar. By tragically simple, I mean the fact is that many, if not most, of our long-term chronic health challenges are at least partially due to the fact that we're not managing our sugar correctly, and it's so darn easy to do. Reduce the stress response, whether it's physiological or mental or emotional. Limit your intake of blood sugar spiking foods, and get yourself on a good nutritional supplement program that features those high-powered electrical nutrients, the B vitamins and the electrolytes, as well as vitamin C. Thanks for thanks for your question. Appreciate it. And thanks for listening if you're out there. We're going to take a commercial break and come back with more of your phone calls and more good health information on the Dead Doctors Don't Lie program. 831-685-1080 is our priority line number, 888-379-2552, toll free. I'm Pharmacist Ben, along with Doug Winfrey, sitting in for Doc today. We'll be back right after this.
Let's head to Charlotte, North Carolina, and Manish, you're on with Pharmacist Ben Fuchs.
Hello, Manish. Hello, Manish. Greetings. Are you there?
Yes. Hi, this is Manish. Sorry.
Hi, Manish.
Hello, Mr. Ben. How are you?
I'm good. Talk to me. What's going on?
So I was calling in for a relative of mine who's actually been diagnosed with AHCD, which is anterior heart cell disease.
I'm sorry. Can you, Manish? I'm having a hard time hearing you. Can you say that again? Diagnosed with
AHCD, anterior horn cell disease.
Okay.
And this actually dates back to actually 3 years ago, where actually she met an accident, and hit herself on the back. And since then, her health started deteriorating, and basically her mobility on the hands, specifically the shoulder, started going down. So basically, her movement on the left shoulder started.
Okay. All right. Okay. That's enough information. Manish, my friend, okay. That's enough information. Let me repeat back to you so I make sure I understood everything. Okay. She got an injury, and now she can't move her body as well. Is that pretty much it?
Yes, that's true.
Okay, good.
That's true.
All right. So here's the deal. When you're recovering from an injury, there's a couple things you got to do. First of all, the most important thing, and keep in mind, the body's nature is to recover from injury. In fact, not only does the body recover from injury, it recovers better from injury. In other words, the bone is always stronger at the point of the break. This is the nature of the body. If healing is not occurring appropriately, there's a couple factors that you want to address. Number one is something we call inflammation, which I'm sure you've heard of. Inflammatory factors near in the body, whether it's associated with the injury or whether it's associated with sugar or digestive problems or anything else, are going to slow down healing. So the first thing we want to do is we want to reduce the entrance of pro-inflammatory factors into the body, and that means digestive health. Number one, it means focusing on anything you could do to improve nutrient absorption. And number two, it means doing anything you could do to keep the entrance of toxins into the blood through the digestive system down. Step number one, look for problem foods, link them up to digestive health issues, constipation, bloating, gas, etc., and eliminate those problem foods. Number two, get on a good probiotic supplement, use your ultimate enzymes with meals, and make sure you're using a little apple cider vinegar with your ultimate enzymes with your meals. And then take some ultimate enzymes on an empty stomach too. They got wonderful anti-inflammatory properties. With your meals, use your glucogel caps and use your Beyond Tangy Tangerine. Why with your meals? You'll increase the absorption. Once you have some digestive juices going from foods, you're going to improve absorption of both the nutrients from the Beyond Tangy Tangerine as well as the glucosamine from the glucogel caps. And it's a good idea to mix your Beyond Tangy Tangerine or take your Beyond Tangy Tangerine with your glucogel caps, as vitamin C is very important for the activation of connective tissue. Now, if she's got pain associated with the inflammation, you might want to throw in some CM cream or some oral CM, some of the oral CM capsules, because cetyl-myristoyl is one of the all-time great anti-inflammatory and pain-relieving supplements, although it is not part of the Mighty 90 essential nutrients. And if she wants to do a couple more things, in my opinion, it would be a good idea to get on the Fucoid Z. Fucoid Z is wonderful for helping clean the blood. It's just an overall health tonic. And then don't forget about good old chicken soup with the bones. I call it bone soup. When you dissolve the bones in water, the cartilaginous factors go into the water. Those the white stuff that's on top of the chicken bones, that's cartilage. And when that cartilage dissolves in the water, it has wonderful anti-inflammatory and joint-building effects. So it wouldn't be a bad idea for her to start controlling her blood sugar, doing a little bit of exercise, very little bit. Whatever she can do. I understand that she can't move her body as well. But most importantly, work on the digestive system, prevent the influx of inflammatory factors, and also make sure that she's using her nutrients with food so she can maximize their absorption. Thanks so much for your call, Manish. I hope we helped you out. And let's see if we can get one more call in before I break, Doug.
All right, let's head to Bryan, Texas. And Jane, you're on with Pharmacist Ben Fuchs.
Hey, Jane.
Yes, hi, Ben. I have a question. It is, what causes a sore buttocks? To the point one cannot sit without a donut.
Sounds like sciatica. Did anybody ever tell you about that? Sciatic nerve inflammation?
No.
Okay. So there's a nerve that runs from your butt down to your leg. It's called your sciatic nerve. And it can become inflamed for a lot of reasons. And much like we were talking with Manish earlier, whenever I think of inflammation, I think of issues with the digestive system, and that means doing all your digestive health strategies that we just talked about. Number two, one of the reasons why people have sciatica problems is because of some kind of compression of that nerve, and that has a lot to do with, in addition to inflammation, as we just said, that has a lot to do with how we hold our body, our posture, and also how we walk. If that's the case, then probably you want to get it manipulated by have some chiropractor who understands how that part of the body works, and they do manipulation and massage, and they can break up scar tissue, and they can also help straighten out or help relieve compression if there's an inappropriate compression. So a combination of body work and digestive health strategies. If you want to use some nutritional supplementation, essential fatty acids, which I forgot to mention to Manish, are your anti-inflammatory and inflammatory chemicals. In other words, the body controls the inflammatory process by balancing out inflammation chemicals with anti-inflammation chemicals, and these chemicals are directly related to essential fatty acids. Under conditions of deficiency, inflammation is much more likely, so making sure you're using your ultimate EFAs 9 a day in addition to all the digestive health strategies that we talked about. And then for anybody with sciatica, I would highly recommend a good chiropractor, somebody who could do what they call manipulation, where they help break up scar tissue and relieve compression. Thanks for your call. Appreciate it. And I think we got time for another call, don't we, Doug?
Yeah, we sure do. Let's head to Canada, and Rennie, you're on with Pharmacist Ben Fuchs.
Hello there, Rennie.
Hi, Lee couldn't make it, unfortunately. The connection was bad, so I'm standing in. I'm Ken. And
what's going on?
He's a new member, has serious problem with kidneys. He's on kidney dialysis.
Okay.
He's on the transplant wait list. His other big problem is something to do with his parathyroid.
Okay, yes, they're all connected. The parathyroid helps control how calcium is handled by the body. Kidney disease is oftentimes caused by calcium imbalance. It's all kind of connected. The job of the kidneys is to filter the blood. And I've often said that the main cause, direct cause of all chronic degenerative diseases is dirty blood. Now, true nutritional deficiencies are involved. In fact, they're a big component. It's also true that problems handling sugar are involved, and also stress and the stress response. But fundamentally, when the blood becomes dirty, we get sick. The kidneys filter the blood, so if the blood is toxic, or if there's particles in the blood, or immune factors in the blood, or the body's not handling minerals correctly, the blood will become sludgy and thick, and this will create a big burden on the kidneys. And this really is the number one cause of kidney disease: dirty blood. Sugar is also involved. Sugar acts as blood dirt. So what do you do if you got kidney issues, kidney disease, and it's extremely common? Although not necessarily bad enough to go on dialysis, although that's becoming common too. But everybody, most people who have a chronic health problem are going to have some degree of kidney dysfunction. So what do? Number one, you got to clean the blood. That means doing a food diary and eliminating problem foods. That means using all the digestive support strategies that we've already outlined, using your ultimate enzymes and a good probiotic supplement like the Ultimate Nightly Essence, the Fucoid Z, apple cider vinegar with your meals, and of course, staying away from problem foods. Using electrolytes is also important, particularly if you have a calcium problem. Magnesium naturally helps balance out calcium. So getting on a good magnesium supplement, the Beyond Osteo FX, love that one. And then also, it wouldn't be a bad idea. I like chelation therapy, which is where you use supplements that help magnetically attract minerals out of the blood, excessive minerals out of the blood. The Ultimate Selenium acts as a natural chelating agent. And then vitamin K is also very important. Vitamin K acts like a calcium magnet too. Vitamin K is found in fatty foods and also, of course, in your Mighty 90 essential nutrients. A couple more things. You might want to focus on the whole blood sugar aspect, using the Sweeties and the Ultimate Niacin and keeping your blood sugar low. This is true for anybody who's got a kidney problem. The blood sugar system and the kidney are highly connected, and that's why one of the side effects, or one of the associated complications of diabetes, is always going to be kidney problems. Okay, we're back on the Dead Doctors Don't Lie program. I'm Pharmacist Ben, sitting in for Doc today along with Doug Winfrey. 831-685-1080 is our priority line number. 888-379-2552, toll free. Who's next on the line, Doug?
All right, let's head to New Jersey. And Mike, you're on with Pharmacist Ben Fuchs.
Hey, Mike. What's going on, man?
Hey, good morning. Good afternoon.
We're in Jersey. Where are you from in Jersey?
Plainfield.
Plainfield. All right. I love New Jersey. I'm a fan.
Okay. I have a question. I'm a diabetic.
Okay.
And I was introduced by one of your distributors, and I just want to know about the essential vitamins because I wasn't a person that took vitamins. I'm 51 years old, so it's going to be new to me, all these vitamins.
Okay, so let me simplify it for you. And I touched on it a little bit with our last caller, but let me simplify everything, okay? Diabetes is a blood sugar issue. There's only two reasons why the blood sugar goes up: the stress hormone cortisol and what we eat. Those are the two reasons why our blood sugar gets whacked out. The stress hormone cortisol is linked to emotional, mental stress for sure, and it's also linked to physiologic stress. That is, if you have an autoimmune condition, or you have, God forbid, cancer, or you have a kidney problem, all of these can cause cortisol levels to go up, and that's going to whack out your blood sugar. So you got to deal with any underlying health challenges first, and that's the first thing. The second thing, and probably the easiest thing to do, is just limit or restrict or reduce as best as you can your intake of foods that spike your blood sugar. And there are lots of them. In fact, most of the foods we like spike the blood sugar. So if you're having a hard time doing it, kind of wean yourself away from the foods that spike your blood sugar and start eating more good fat, quality fat, as well as more protein. You got to be a little bit careful with the protein because protein can actually get turned into sugar, and that can also spike your blood sugar. And that's one of the problems people have, by the way, when they go high protein or they go paleo, which is a high protein diet, and they notice that their blood sugar either goes up or it doesn't go down. That's because the body very effectively turns protein into sugar if it's not being used. So if you're going to up your protein, get your butt in the gym and do a little bit of a workout. In fact, doing some physical exercise is a great way to help lower blood sugar. And then the third piece of the puzzle, and arguably the most important piece of the puzzle, is to make sure you're using nutrition, especially, as I said earlier, electrical nutrients, the B complex, vitamin C and electrolytes, Dr. Wallach's genius formulation, and Richard Renton's genius formulation, the Beyond Tangy Tangerine, is loaded with these kinds of nutrients, the B vitamins particularly, as well as electrolytes. So making sure you're using your Beyond Tangy Tangerine is important. Chromium and vanadium stand out as nutrients, as minerals that are important for blood sugar control. Sweeties has got the chromium and vanadium. The ultimate selenium is important for helping the body make insulin. And then last but most certainly not least when it comes to blood sugar control is the amino acids taurine and arginine, which you'll find in the Slender FX shake, as well as the new Keto FX products, which are a wonderful way to help lose weight, as well as to stabilize blood sugar. A few more things that you might want to consider: the Fucoid Z, which is a general blood tonic, as well as the ultimate essential fatty acids. Get on the Healthy Start Pack if you just want to be absolutely sure. The magnesium in the Beyond Osteo FX is also very good for helping the body, helping stabilize blood sugar. Lots of wonderful strategies there. Nobody has to suffer with diabetes. Heck, nobody has to suffer with any chronic long-term degenerative disease because it's in the body's nature to heal. Thanks for your call. Appreciate it. And let's see if we get one more in before we got to go.
All right, let's head to Alabama. And Uta, you're on with Pharmacist Ben Fuchs.
Hey, Uta. How you doing?
I'm doing great. How are you?
I'm good. Is it UTA, Uta?
Yeah, it's Uta. It's German. That's why it's a little bit
Uta.
different.
I like that. What's going on? How can we help you?
Fatty liver and enlarged liver.
For fatty enlarged liver. Well, the liver does the work of cleaning things out. It's a detoxifying organ. So it makes sense that we would have an epidemic of fatty liver disease. You're not alone, Uta. 100 million Americans are dealing with the problem. That's in addition to helping the body detoxify substances, the liver is a digestive organ and a blood sugar organ. So step number one, look for problem foods and eliminate those foods. Use digestive health strategies, including the ultimate nightly essence. Probiotics are very, very important for the liver. Also the ultimate enzymes, and in addition to eliminating problem foods, you might also want to practice calorie restriction, where you eat less calories. Secondly, work on your blood sugar. Everything we've talked about several times today, really working on the blood sugar with the B complex and your Beyond Tangy Tangerine and your Sweeties, as well as the Fucoid Z and the Beyond OsteoFX and the Ultimate EFAs. So many things we could do, folks. Nobody has to be sick. I know there's 100 million Americans that are dealing with chronic degenerative diseases, but it is tragically unnecessary. Get yourself on a good nutritional supplement program like the one designed by Dr. Wallach and watch what happens, and you'll see that we're not sick, folks. We're starving. I'm Pharmacist Ben. Thanks for listening. Have an awesome, wonderful, beautiful day. We'll talk to you all later, folks. Bye for now.